Hello, I am Pharmacist. Today we talk about another class of antifungals, azoles. Let's go. 1. Fluconazole. Pharmacology. Fluconazole is a triazole antifungal that inhibits the synthesis of ergosterol in fungal cells. Uses. It is used for the treatment and prevention of various fungal infections, including candidiasis, cryptococcal meningitis, and systemic fungal infections. Side effects. Common side effects include nausea, vomiting, abdominal pain, diarrhea, headache, and rash. Rare but serious side effects may include liver toxicity and severe allergic reactions. Contraindications. Known hypersensitivity to fluconazole or other azole antifungals. Pregnancy. Generally considered safe, but high-dose or long-term use should be avoided. Warnings. Caution in patients with liver disease or impaired kidney function. Drug interactions. Interacts with certain medications, such as warfarin, phenytoin, and rifampin. Dosage. Ranges from 50 mg to 800 mg per day depending on the indication and severity of the infection. 2. Itraconazole. Pharmacology. Itraconazole is a triazole antifungal that inhibits ergosterol synthesis in fungal cells. Uses. It is used for the treatment of aspergillosis, histoplasmosis, blastomycosis, sporotrichosis, and onychomycosis. Side effects. Common side effects include nausea, vomiting, abdominal pain, diarrhea, headache, and rash. Rare but serious side effects may include liver toxicity and cardiac effects. Contraindications. Known hypersensitivity to itraconazole, co-administration with certain drugs, and certain cardiovascular conditions. Pregnancy. Generally not recommended unless the benefit outweighs the potential risk. Warnings. Caution in patients with liver disease, cardiac conditions, or impaired kidney function. Drug interactions. Numerous drug interactions, including cisapride, statins, and certain anticoagulants. Dosage. Ranges from 100 mg to 400 mg per day depending on the indication and severity of the infection. 3. Voriconazole. Pharmacology. Voriconazole is a triazole antifungal that inhibits ergosterol synthesis by interfering with fungal cytochrome P450 enzymes. Uses. It is used for the treatment of invasive aspergillosis, candidiasis, and other serious fungal infections caused by susceptible organisms. Side effects. Common side effects include visual disturbances, fever, rash, nausea, vomiting, and headache. Serious side effects may include liver toxicity and cardiac effects. Contraindications. Known hypersensitivity to voriconazole or other azole antifungals, concomitant use of certain drugs, and certain cardiovascular conditions. Pregnancy. Generally not recommended unless the benefit outweighs the potential risk. Warnings. Caution in patients with liver disease, cardiac conditions, or impaired kidney function. Drug interactions. Numerous drug interactions, including rifampin, phenytoin, and certain immunosuppressants. Dosage. Ranges from 200 mg to 400 mg twice daily for most indications. Ketoconazole. Pharmacology. Ketoconazole is an azole antifungal medication that inhibits the synthesis of ergosterol, a key component of fungal cell membranes, by inhibiting the enzyme linosterol 14-I-circumflex + demethylase. Uses. Ketoconazole is used for the treatment of various fungal infections, including candidiasis, such as oral and esophageal candidiasis, cutaneous dermatophyte infections, such as tinea corporis, tinea cruris, and tinea pedis, cutaneous candidiasis, seborrheic dermatitis, pityriasis versicolor, systemic fungal infections. In some cases, when other antifungal agents are not available or appropriate. Side effects. Common side effects of ketoconazole may include nausea, vomiting, abdominal pain, headache, and rash. Other potential side effects may include hepatotoxicity, liver damage, adrenal insufficiency, and drug-induced hepatitis. Contraindications. Known hypersensitivity to ketoconazole or other azole antifungal agents is a contraindication for its use. Pregnancy. Ketoconazole is generally not recommended for use during pregnancy, particularly during the first trimester. Unless the potential benefits outweigh the risks, it should be used only if there are no safer alternatives available. Warnings: caution is advised in patients with liver disease or impaired liver function, as ketoconazole can cause hepatotoxicity. Drug interactions: ketoconazole has the potential to interact with several medications due to its inhibition of cytochrome P450 enzymes. It may increase the plasma concentrations of drugs metabolized by these enzymes, leading to increased toxicity. Some examples of drugs that may interact with ketoconazole include certain statins, warfarin, cyclosporine, and oral contraceptives. Dosage: the recommended dosage of ketoconazole depends on the specific indication and the severity of the fungal infection. It is typically administered orally. For most infections, the usual adult dose ranges from 200 mg to 400 mg daily. However, the dosage may vary based on individual factors and the specific condition being treated. It is important to follow the prescribed dosage and duration of treatment as directed by the healthcare provider. Posaconazole. Pharmacology. Posaconazole is a triazole antifungal agent that inhibits the synthesis of ergosterol in fungal cells. Uses: posaconazole is used for the prevention and treatment of various fungal infections, including invasive aspergillosis, candidiasis, including oropharyngeal and esophageal candidiasis, mucormycosis, fusariasis, coccidioidomycosis, prophylaxis of invasive fungal infections in high-risk patients, such as those with prolonged neutropenia or undergoing hematopoietic stem cell transplantation. Side effects: common side effects of posaconazole may include gastrointestinal symptoms, such as nausea, diarrhea, and abdominal pain, headache, and increased liver enzymes. Serious side effects may include hepatotoxicity and cardiac effects. Rare contraindications: known hypersensitivity to posaconazole or other azole antifungal agents is a contraindication for its use. Pregnancy: posaconazole is generally not recommended during pregnancy unless the potential benefits outweigh the risks. It should be used only if there are no safer alternatives available. Thank you.